few months ago, a woman came to the clinic. She came to the clinic, she has a wound. She came for us to, treat the wound. She came for treatment. I now asked her during the personal data taken up. I now asked her, Madam, please, this wound is not fresh wound. When did it happen to you? How come? What happened? She said no, so that the thing happened to her about it have been over a year. She have that wound in her leg. And the woman is not that old though. She's a young woman. She's a young woman. Once she said that it's been a year plus, I was like, a year plus. She narrated how the thing happened, that she had an accident, and her leg was affected. She sustained injury in her leg. It was like over a year plus, no progress. She said she had been taking a lot of treatment. She had gone to different places for treatment. She had taken a lot of antibiotics. Even that day she came with an antibiotics, the one injectable. She said it will help to inject her the drug that they gave it to her in a pharmacy. To her, she said they prescribed the drug for her. She went and bought it. She came with the drugs, but I asked her so many questions. After the while, I asked her, Madam, you need to check your blood sugar level. She came in the evening, and meanwhile, the best time to check blood sugar level is in the morning. I told her, Madam, I will check your blood sugar level. I asked her, Ma, please, are you diabetic? The way she answered me, like, Magonu, some people, when you ask them some questions, they'll be like, God forbid. Sometimes some people, if you ask them questions, they'll be like, God forbid, Holy Ghost fire, Holy Ghost fire. The way she answered me, I said, okay, Madam, don't worry. Tomorrow, when you come, we'll check your blood sugar level. Now, this is why I narrated this story. I want to point out some of the things that can delay wound healing. Diabetes is the major reason for delay in wound healing. Wound healing tends to be very slow in people that have diabetes, because there is the body produces no or insufficient insulin. Insulin is a protein. Yes, is a hormone responsible for regulating blood glucose, that is blood sugar. So when someone have a diabetes, you notice that it will delay wound healing. In fact, many people who have diabetes also have problem with immune system activation. The number of immune fighter cells, the number of immune fighter cells sent to heal the wound, and the ability to take action is often reduced. I'm talking about the causes of delay in wound healing in diabetic patients. Many people who have diabetes also have problem with immune system activation. Again, uncontrolled diabetes may also affect circulation, causing the blood to move slowly, which make it difficult for the body to deliver nutrients to the wound, which may result to slow healing or no healing at all. You see, one of the reasons why wound delays to heal is because the patient is diabetic. Some don't know this. Sometimes when wound delays to heal, some people who don't know their status, who don't know whether they are diabetic or not, may think that n'aka ndị ọjọọ dị ya, that this wound ọ dịkwa na how many months now, how many years, ọ naghị ana what is ihe nka ọnwụ n'ọgwụ nke ọnwụ na nke ọzọ, na witches and wizards, no village people, no ha nwa ihe na-emedite. But in actual sense, some bụ as a result of diabetes. Diabetes delays wound healing. In fact, some people achọpụta na diabetic, one of the advice I enye gị bụ, please do not, in fact, ihe ọbụla ga-eme gị ka inwe cut, run away from that. You, as a diabetic patient, you don't do some certain things to avoid injury, because if you, as a result of the thing you are doing and you get injury, to heal might be difficult. It may or may not heal. So it is very difficult for wound to heal. I'm talking about diabetic people who are diabetic. So if you are diabetic, you are watching this video, please, in case you don't know it today, that wound healing is always wound tends to delay in people that are diabetic. Wound healing tends to delay in people that are diabetic. So if you are diabetic, anything that may cause harm or injury to your body, run away from it. Please, run away from it. Prevention is better than cure. Yes. The other day I was watching somebody. He was lamenting about his health status, how he was advised to stay away from some certain things to avoid injury because he's diabetic. He's not too old, he's a young man, and he's taking he's according to him, he's trying to take the precaution to he's trying to avoid those things, to avoid some certain things. He don't want to get injured because once he gets injured, to heal, for the wound to heal might be difficult. This is a practical example of what I'm saying. Wound healing is always slow for diabetic people. Now, I want to talk about some things that can help diabetic wound to heal faster. What can help a diabetic wound to heal faster? First, managing of blood sugar level. You must be monitoring your blood sugar level. At least it's not costly. Highest 1,000. Go to medical checkup. 1,000 or 500, depending on the area, your location. They will check your blood sugar level. Malagodi kodi. Now, mala case eso the wound. Mala the proper treatment to give to the wound. Mala know the state of your blood sugar level and appropriate drug to use and treat the wound at that period. That will be effective. That's number one. Managing of blood sugar level. And you cannot manage it blindly. You must adhere to the instruction. After checking the blood sugar level, adhere to the medical instructions, the advice given to you by your health caregiver. You follow it up for your own good. And again, implementing strategies to improve blood circulation. Yes, that is one of the way to help wound healing in diabetic patients. You must be able, to
implement.
some certain strategies. For example, exercise. You must be exercising regularly. Exercise, it helps for blood circulation. In case if there is any blood clot, or maybe the blood circulation is low, once you are doing exercise, it will help to circulate, to help to improve your blood circulation. It will help in healing, in the wound healing. Again, if you are a smoker, you quit it. Yes, if you are a smoker, you quit it. Quit smoking. Yes, when you quit smoking, it will improve the wound healing. In case if you know someone, or you know someone that knows someone that has wound, as in that has wound and the person the diabetic or not, advise the person to go to hospital for proper checkup. Sometimes this wound you can get wound, you can get injured by anything, by any you can be cutting vegetable, you injure yourself. You can be doing something in the farm, you injure yourself. You can engage in some certain domestic work, you injure yourself. And if you are diabetic, to heal, for the wound to heal might be difficult. It may not heal, it may or may not heal self. So it is very necessary that once in a while you go for medical checkup. Check your sugar level. Yes, about Sunday ka young people, you can decide to, you can check, you can there's nothing there to check your blood sugar level. Pamela, came out your status, came out made the diabetic or not. Okay, the young man, I was listening to his broadcast the other day. He's not old. In fact, I'm not even sure that he's married yet, but he's diabetic. How did he know? Through medical checkup. And thank God for him. I think he must be managing himself well, because he's aware of his condition. So medical checkup is okay, it's necessary, it's very important. Extremely important. Compulsory, extremely compulsory. It's compulsory, it's necessary. In fact, it's not compulsory, but it's necessary that you check up, you go for medical checkup once in a while. Check your status, check your BP, check your blood sugar level. Okay, in my previous video last year, I think I explained diabetes, types of diabetes. If you have not watched the videos, you can go and watch it, or if need be, I can redo the videos. But I have explained the diabetes one after the other. Even diabetes due to what am I even saying? You can go back and watch the videos. Education is power, knowledge is power. Thank you for watching. Please, I want to beg for a favor. Please, I still remains your girl, Oma, your favorite health educator. Help me to share this video. Should I kneel down? Oh my God. Help me support my ministry. If this video is helpful to you, share it out, please. Share it to your loved ones, share it to your family members, share it to your friends, share it to any place you can. Help me support my ministry. Just share this video, share it. I love you, I love you, I love you, I love you, I love you so much. One, take a kiss. Bye. See you in my next video. Thank you. Bye.